Are you struggling with PCOS and basically just understanding what insulin resistance is? Because it's like a medical term that you don't understand. Do terms like insulin resistance or PCOS or PCOD or ATP, glucose leave you confused and unsure of how to manage your PCOS? If so, you are in the right place. In this video, we are going to break down insulin resistance specifically in a way that anyone can understand, even if you never studied science. More importantly, we'll dive into how the silent killer is affecting your PCOS and what you can do to take control of your health once and for all. If you're ready to stop feeling lost and start feeling empowered, then stick around. By the end of this video, you'll have a practical, easy to apply strategies to manage your insulin resistance and take charge of your PCOS journey. So let's get started. By the way, I'm Dr. Rashmi Pawar. I'm a specialist gynecologist for almost 15 years who's turned into a life coach specifically to help PCOS women manage their mind so that they become insulin sensitive before they get pregnant. So, what is insulin resistance? Insulin is basically a hormone and which is not working, and that's insulin resistance. Now, for you to understand what insulin resistance is, I want you to imagine your body, it's full of cells, right? Like they're teeny tiny cells. We don't see it, they're very small. And each cell needs energy. For each cell to get energy, we need to have ATPs. ATP is the energy source. Now, this ATP we can get either from glucose, we can get it from amino acids, or we can get it from ketone bodies. These are the three energy sources. So glucose comes from carbohydrates, amino acids comes from protein, or ketone body comes from fats. So with respect to PCOS and insulin resistance, we are going to talk about carbohydrate use of energy. And that is not working properly in insulin resistance. So I want you to imagine your body as a large house with small rooms. Many rooms, and these rooms are basically your cells. Now, food that you eat is like groceries that you need to deliver to each of these rooms because that food needs to be used as energy. However, these rooms have doors which are locked, right? Like these cells have doors or barriers which are locked. Now, for us to push the food inside this room or the groceries, which is basically glucose from carbohydrate, which is a source of energy, we want to send it into the room, we need to have a key because this door is locked. Now, this key is called insulin. Now, when you eat food, most of us are having carbohydrate-rich foods. So we have lots of carbohydrates in our bloodstream. It goes inside and breaks down into glucose. Now we have a lot of this glucose circulating in the blood, and this glucose needs to go to each cell in our body and try to enter in as energy, the groceries that we want to provide in each room, right? Now for the sugar or the glucose to get in, we need the key, which is insulin. So insulin is basically this special tool that helps you move the glucose from the blood into the cells where it can be converted into ATP or as energy for us so that we can carry on doing our day-to-day functions. Normally, insulin opens the door to our cells so that the glucose can get in and give you that energy. But when there's insulin resistance, that key is not working as well. The doors are harder to open. So when the doors are not opening and then there is so much glucose in the blood, what the body does, it starts making more keys so that some key will work, right? So the pancreas will produce more insulin to try to get the sugar in. So with so much insulin, what happens? It worsens insulin resistance. It's like somehow the cells become more locked. So over time, what will happen is a lot of sugar will still be in circulation, which is not getting used into the cells. And this is why you feel so exhausted, because your cells didn't get any energy because the glucose is not going into the cells. You still feel exhausted because you didn't get the energy. So you keep eating more carbohydrate foods thinking you'll get the energy, but you never feel refreshed. And all this glucose, which is like unused energy, stays in the blood. Now this glucose is not good for your cells, so it will start harming each organ. And eventually, when it's not used up, it doesn't go in your urine or poop. It will get converted into fats. So that's why it's PCOS women keep gaining weight, some of us. So how does insulin resistance affect PCOS? So if you have PCOS, insulin resistance can make things worse for you. Number one, it produces hormonal imbalance. When your body produces extra insulin, it can trigger your ovaries to produce slightly extra male hormones like testosterone. These can mess up your periods. It will stop your ovulation. You will not have regular periods. You might have irregular periods, heavy periods, or no periods. You might develop excess hair growth on your face, on your chest. You might develop excess acne. Apart from this, as I described earlier, you might get weight gain because all that extra glucose which is circulating in your blood gets converted into fats. And carrying that extra weight can worsen your insulin resistance and PCOS symptoms, thereby producing a vicious cycle. Lastly, it can produce difficulty to ovulate. That hormonal imbalance can lead to, we have a delicate hormonal balance every month, women, so that they can produce one egg each month so that she can get pregnant. When there is no baby at the end of the month, period comes. So that cycle is happening since we started getting our first period. But when you have insulin resistance, this delicate hormonal balance is gone and you don't make that monthly egg. Thus it can produce infertility. So how do you deal with insulin resistance and manage PCOS? The good news is that insulin resistance can be managed. Just like diabetes, we can manage PCOS without medication and significantly improve your PCOS symptoms. Here's how. Number one, you need to eat balanced diet. So I recommend you do an audit of what you're eating. So just write down for like a week what you have eaten. And you'll get to have an idea of like what are you actually eating, how much of refined carbs are you actually eating. You need to focus on whole foods, foods which have vegetables, fruits, lean proteins, good fats. These foods help you keep your blood sugar stable. Also, you need to limit your refined carbohydrates and sugars like white bread, pastries, sugary drinks. So I basically club it into like anything which is made of flour, atta, that is going to produce insulin resistance because it will produce a very high sugar and insulin spike. Also, artificial sugar would do the same. Especially if you want to correct your insulin resistance, you need to bring down your insulin, and by that you need to bring down your carbohydrate intake so that you can manage that insulin spike. Instead, consider going on a low carb or a low glycemic diet. These diets focus on foods that cause big spikes in blood sugar, which can help manage insulin resistance. So suppose if you're having rice, dal, sabzis, chicken, fish in your meals, like if you have a definite carbohydrate portion of your food, you need to substitute it with like a vegetable, like carrots or cucumbers. Cucumbers are like bland. It has like no calories. It is just water, but it might give you some fiber. You can have those leafy vegetables as salads. So it takes time to chew also, and they don't have much calories. So you can have those with your good proteins, good fats. Second, you need to get regular exercise. So physical activity of any kind can help your body use insulin more effectively. So if you can aim for at least a 30-minute of moderate exercise every day, that will be amazing for your insulin. Even something as simple as a daily walk can make a big difference in improving your insulin sensitivity. Third is manage your weight. If you're carrying extra weight, you're overweight, Losing even a small amount can improve your insulin resistance and reduce your PCOS symptoms. So focus on a slow, steady weight loss through a combination of healthy eating and some movement. Fourth is sleep management. Sleep deprivation can worsen stress hormones, cortisol, which eventually worsens your insulin resistance. So prioritizing sleep for at least 7 to 9 hours each night can go a long way in managing PCOS symptoms. Like, this is a permanent thing. Stress management, number 5. Stress can affect your hormones and insulin level because stress increases cortisol, which worsens your insulin resistance. Cortisol is another hormone which pushes you into a stress response, and that stress response puts you in storage mode, which is insulin resistance. So finding ways to manage your stress, like breathing exercises, doing some yoga, meditation, stretching, mindfulness practices, simply taking some time for yourself on a regular basis throughout the day can be beneficial. Sixth, consider medication. For some people, lifestyle changes aren't enough. So if your doctor finds you that you have lost all the weight and still your symptoms have not reversed, then you might consider going on metformin, of course after your doctor has reviewed you. This medicine might help your body respond better to insulin and can also help you regulate your menstrual cycle. In my personal opinion, if you do all these lifestyle changes and you lose weight and you clean up your food, you don't need metformin. So maybe you might not ever need it. Lastly, monitor your health, regularly checking your weight at least like once a week or like once a month minimum, and monitoring your periods, keeping a menstrual calendar can help you catch issues early on so that you can adjust your management plan if required. So these are all the 7 steps, right, to sort of manage your PCOS and insulin resistance. But what is the long-term management for PCOS? So managing insulin resistance is the key to controlling your PCOS. But it's important to remember that this is a long-term commitment, not something you do for 3 to 6 months. So it's not, if you are trying to lose weight, don't just focus on weight loss. You need to focus on maintenance as well so that that weight doesn't come back. Because I like to think we have to really manage our mind to get started with weight loss. Once you start losing weight, then it becomes easier, right? Because you see like it's working. So you start doing it. And then you get to your goal and you settle in there. And then the brain thinks unconsciously, it will think that, oh, my job is done. We can eat whatever we want now. And slowly, slowly, all the weight comes back. You don't want to become unconscious around this. We PCOS women, we have to be conscious around the way we eat until even in our unconscious brain, we don't overeat carbohydrate-rich foods. Even in our sleep, we are not sleep deprived. It needs to become like a habit, a permanent habit where we just eat healthy. All right. So it's important to remember that this is a long-term commitment, not just till you get pregnant or till you get married. So by making sustainable changes to your diet, exercise routine, and overall lifestyle, you can improve your insulin sensitivity, reduce your PCOS symptoms, and take control of your health. Remember, you don't have to do this alone. Work with your healthcare provider to develop a plan that's right for you. If your doctor is not supporting you in this, find a specialist coach who specifically works with PCOS, like me. If you don't find anyone, please reach out to me. I provide online coaching to manage your mind, especially for PCOS women, so that they can get to their health goals. And your health goals, I can help you get towards your health goals like weight loss, permanent weight loss, or weight gain for some of you lean PCOS, or miscarriages, recurrent miscarriages, and you want to have a healthy baby, or infertility, or clearer skin, or just reducing the hair growth. So with the right approach, you can manage your PCOS symptoms permanently and live a healthy, balanced life. I hope this is helpful. If you have any comments and suggestions or doubts, please post in the comments or reach out to me on my Instagram, which is Dr. Rashmi Pawar _PCOS _coach. and I will get back to you. Until next time, see you.